I know the itis sets in after lunch, so I'm gonna try to. I'm a foodie, so I definitely understand wanting to get your nourishment, and I hope I do my intro justice. That was cool. I've never been introduced by two people, so I definitely feel, you know, trying to make sure I can get this. Okay. Hi. Y'all wait for me. Wait for me. Let me make sure. I'm a professor. This is my 10th academic year at Xavier. Woo, child. Made it through the pandemic. 4 births along that journey. COVID. Some hurricanes in there. So I am happy to be in North Carolina. I was actually here not that long ago. I am a fellow of the UNC National Maternal and Child Health Workforce Development Center. So I was just in Durham this past summer with the other fellows. So I want to give a shout out because I have connections here. And I know the theme for your 2025 event is reclaiming our health and environment. So I just wanted to borrow that word reclaiming and entitle today's presentation Reclaiming Maternal Health in the Era of Climate Change. One of the biggest equity issues, and of course I'm highly biased by saying this, is maternal and child health in our nation specifically. Globally, there definitely are concerns, but when we look at the United States of America, Black mamas are definitely struggling, and I say struggling by definition of the data, the disparities that we see in many of our communities, and these disparities are only exacerbated by the environmental justice issues that many of you folks are championing here in North Carolina. And I definitely want to give a shout out to the faith panel earlier. I took a whole page of notes. I was a good student in the front taking a whole page of notes. And so I really like that y'all were honoring Black women and talking about the 7 generations principle because legacy is big to me. My husband would not have convinced me to have 4 kids if legacy was not a huge family value. But when I think about epigenetics, right, some of y'all, the science of it all, you may be like, well, in North Carolina, you don't walk around calling people Chev. I don't think, Chev, mon ami, my sweetheart, my friend, right? But we would be like, Chev, make it make sense to me. The science, men know, okay? Like what's going on? So if you think about it, when your grandma was pregnant with your mom, so your maternal side, right? Your grandma was pregnant with your mom. You were an ovum, right? An egg in your mom's body when she was in your grandma's womb, right? So whatever grandma was going through, good, bad, or ugly, impacted your mom. And then your mom carried you, right? And you may have your own descendants, right? So that's what epigenetics is. If you've ever seen those old school nesting dolls where it's like boop, boop, and you're just like popping them down the line, epigenetics 101. There you go. And I love that word of reconciliation, right? And if I can share a Bible passage that I think can tie together the environmental justice and the birth justice, right? Matthew 24:19. Woe to the pregnant and nursing mother in those days. The days are here. Woe. Great sorrow or distress, often used in hyperboles. It's an expression of grief, anguish, or calamity. Not woe like ludicrous, get out the way, not that woe. But basically saying it will be a terrible time. We're living that, y'all. I don't know if you believe that scripture, but one of my doulas and lactation buddies was like, girl, that scripture keeps me grounded in the work. And I was like, wow. So next slide. So here's a little quick overview of what I hope to cover in our time. I know you're going to catch something in between that hot meal. But I want to start off with an icebreaker. Next slide. So imagine calling 911 in your time of distress, right? Maybe for some of you, this has happened recently. Maybe for some of you, you haven't had to call 911 in a long time, and I hope it stays that way. But it's a time of distress. You're calling 911. Only for the dispatcher to click. Y'all say click. Hang up on you. Not a good feeling, right? Not a good feeling. Next slide. Last year, my daughter and I worked on a story for my very first keynote I ever did in my life last year, and I'm sharing the link with it with the team so that they can share it with you because it's much longer than the talk I'm doing today. So the story was called Don't Go Click on Climate Change, illustrated by Miss Nia Gross and family because she wanted to be paid for her work. Her dad was like, "You're going to pay my baby if she's doing illustrations for your slide." He used AI to come up with her a little chat, like a little contract. So I had to pay her, but then she started being perfectionist and was like, "All right, we're gonna get the whole family involved so Nia can still get paid." So that's why the illustrations are by Miss Nia Gross and family. So this story is about a little young thing that moves to New Orleans for her laissez le bon temps rouler, like the good life, right? She does this fellowship for community service, and she works as a dispatcher. People calling in for help. But she quickly, next slide, gets disgruntled at the calls and feels like, I'm not a social worker, I'm not a therapist, because the type of calls that are coming in are about, my water tastes funny. It's so hot. I can't afford to keep turning on the air. They're cutting my electricity off because my bill is unpaid and it's too hot, and I'm smelling smoke from the marshes burning, and we have asthma and I'm pregnant, right? So these climate emergencies, she wasn't ready. She was ready for cats in trees and fender benders and help, I've fallen and I can't get up, like those type of things. And she hangs up on the people because she lacks compassion. Well, that's what many of our policymakers and institutions are doing. They are showing a lack of compassion during these climate crises. Next slide. And the stories were based off of real events only from 2023, only from 2023, right? You can see here, go back to the previous slide. So she even had a caller from California that was like, "Help, Hurricane Hillary's coming in. We don't know nothing about no hurricanes over here, but y'all do." It's like, click, call FEMA somebody, right? I don't know, did y'all hear about super fog in Louisiana and the massive car pileup we had? Because it was so hot, the marshes kept burning, and it combined with fog to where there was zero visibility when people were driving on the interstate. Meanwhile, me and my mom are like, "We're glad we don't have fires here next week." I was like, I thought the air here was so moist, like pseudoscience. It was fake science. All right, next slide. So we're seeing all these things happen. And then at the beginning of 2024, just about a year to the day, we were shut down for some really severe freezes. And we're anticipating one next week, right? So we didn't have hurricane school closures, but we had closures from extreme cold, something we don't really know. People laugh about Georgians and the snow and building the snowman and all of that, right? But we really don't know what to do about extreme cold either. Next slide. It was also based off of a real rogue 911 dispatcher we had in New Orleans that was hanging up on people in their time of need. Next slide. 911 is designed to help you and assist you. It shouldn't be to hurt you. What is most important is that the first call is answered quickly and processed to initiate a public safety response. Next slide. So who will answer their cries and calls for help before it's too late? So that's how I want to open us up today. Next slide. Why do I personally care? Am I a climate change nerd? Am I a crunchy granola doomsday prepper? I don't identify with any of that. But from my lived experience being born and raised down the bayou, I've just started connecting the dots. Next slide. This is the squad. This is the Gross crew. You see us with our, little G matching Christmas sweatshirts there. Legacy is definitely of value to me. And when I first learned about the 7 generations principle, and raise your hand if you're familiar with the 7 generations principle. Only a few people. Okay, so seven generation principle that we see many indigenous tribes ascribe to and similar concepts in other cultures is before you make a decision, you think about the next seven generations that come after you and the impact of that, right? Well, this one Native sister said that can be a little hard for people to think about, right? But if you think about being in the middle of seven generations, the three before you and the three after, it can be a little bit easier to conceptualize, right? So we think about what have we inherited in terms of policy, injustice, environmental hazards in our community, right? In terms of our faith heritage, in terms of our educational system, right? Not just so-and-so had diabetes or gout or cancer, those things, but we're thinking about all of it, right? And then what are we passing down to the next three? Because it might be too hard for us to think about the next seven. I also think about the first birth I ever fully witnessed besides my own was in Ghana on study abroad. And that trip was amazing, seeing the slave castles and the door of no return and meeting the people there and just really being engulfed in their community and seeing the cultural practices of maternal and child health that they still hold true and how disconnected some of us are from those practices. But at the same time, seeing 4 babies in an incubator in the NICU that's smaller than the size of this room, right? So I just want us to think about that. Next slide. More recently, Hurricane Ida came the semester I was going up for tenure, y'all. So Hurricane Ida came in 2021, the first week of classes. We just had our first week of classes this week. And so we went to Texas for about a week, and it was our first time having to evacuate, thinking about our kids. My husband and I actually met because he was displaced from Hurricane Katrina. So it's kind of like the disaster is part of our love story, if you will. So we always kind of knew, we have to be, vigilant about disasters. I did my postdoc in Galveston. If you know anything about Galveston, Texas, like the Great Hurricane of Galveston, right? It didn't even have names. It was like just the Great Hurricane of Galveston. So with his Katrina-itis, right? He's like, listen, we got to know what we're going to do anytime a storm comes, because now we have kids. I'm like, I got you. So we went to Texas for a week. Then things got old and expensive, and it's time to come home. And we came home to our damage. And we would live with this damage for quite a while because our insurance company went bankrupt after our roof was fixed, as has been common in Louisiana and Florida. And with the fires in California, I anticipate hearing some of that again. But just the trauma of the storm is over, like the initial storm is over, but the aftermath continues, right? So I just want y'all to think about what is it like for those that are raising children, having new children in this landscape. You may not consider yourself a maternal health advocate, but after today, you all will be commissioned to join me in this work. And fun fact, April of last year, our mortgage went up a whole grand because of home insurance hikes. No renovations, no square footage added, no man cave redevelopment, none of that. Strictly to ensure our current property. Next slide. So as I've been exploring resources as both a parent of 4 and also a maternal and child health scholar, I've learned that there are mental health specialists that are specializing in looking at the trauma, the stress that is coming from these disasters. So this is just a screenshot from this webinar I went to where different parents were saying, like, this is what I've experienced in this region. Like the weather is not the same weather it used to be. Summer's not summer anymore, and winter's not winter. It's like any given day it can be something, right? So there's now eco-grief. There's clinical words for this now, y'all. Next slide. So before I head home and before you head home, I want to empower you to join me in this work. So on the next slide, there will be some fast facts. Extreme weather events are increasing in frequency and intensity despite geography. Do we agree? Black and brown communities like yours and mine are most vulnerable both domestically and abroad. There is a gentleman, Climate Change is Racist is the name of the book. Small book, but he talks about this from a global perspective of environmental injustice in Black and brown communities, not just in the US. He hails from the UK and has a really interesting perspective as a white man that grew up in, I believe it's Kenya, on issues of race and issues of environmental justice. Pregnant, postpartum, and families with young children are also most vulnerable. And fun fact, they're not included many times or prioritized in disaster preparedness plans. These events and disasters have profound mental health, like I mentioned in the previous slide, and there are gaps that exist when we think about who is engaging and including them in response efforts and planning. Next slide. So just imagine this is the landscape. The maternal child health advocates are saying, help our families, our breastfeeding moms. We're running out of formula. You know, we have babies that just came home from the NICU, they're vulnerable. We're having these conversations in Louisiana. We've been having these conversations in Louisiana, but we're probably not that far ahead of you all in terms of connecting these dots. And the climate change and emergency preparedness experts are vigilant, doing their thing as they should, because things keep happening. But we're trying to be bridge builders. Next slide. Inauguration, I know, me and Uncle Sam, but I just feel like I was in DC originally. So you have the power to bridge these gaps. Say, I have the power to bridge these gaps. And if you are chewing, that's okay. I'll hear from you later. So, as advocates, understand the unique vulnerabilities of and increased risk for mothers and children in disasters. Raise your hand if you're a parent. Your lived experience gives you expertise already, right? Build resilience through disaster preparedness. Raise your hand if you've ever been through fire, flood, freeze. Your lived experience also gives you expertise. And we need to work together, okay? Because we have different lens of expertise. Reach into your bag. There is a handout specifically on maternal and child health in North Carolina that the team put together for you. So if you're newer to some of the terminology I'm going to share in the next slide, there is a tangible, for my old school and for my new school, there is a tangible handout in your materials that they gave at registration. So next slide. So a few definitions that you'll hear in the field of maternal and child health. Perinatal is the time around birth and pregnancy, up to a year after giving birth. So we hear, instead of people just saying postpartum depression now, we're hearing perinatal mental health. Because to think that depression just all of a sudden happened when the baby came, there were signs and symptoms that were probably building during pregnancy and even before conception. Preterm birth. So preemies are babies that are born before 37 weeks full-term gestation. Low birth weight babies are babies that are born weighing less than 5.5 pounds or 2,500 grams if you're in another country. Infant mortality rate, these are babies that don't make it to celebrate their first birthday. Maternal mortality rate is just a number to calculate how many moms are we losing related to pregnancy and childbirth. Next slide. Have you ever gotten a D before? Some of y'all ashamed to say it. I got a D. Organic chemistry the first time I took it. I wrote Jesus help me on the final exam, answered 2 questions, and left. Because I'm like, I'm not sitting here for 2 hours. I don't know this stuff. Everybody looking like, where you going? Home, because y'all don't know this stuff, but you're going to sit there for 2 hours. I know I don't know it, I'm leaving. So the March of Dimes every year is an organization that cares about premature birth and birth defects in children. And they give state report cards. Congratulations, North Carolina, you got a D. Louisiana's jealous because we have an F. And while we kiki and laugh about it, when we look at the statistics, nothing is funny. 1 in 9 babies was born before they were considered full term. In the previous session, the panel had mentioned medical debt. Think about the cost when your baby is born early and the ripple effect if insurance is not covering everything that your child needs. Similarly, most of these babies are born low birth weight. 825 infants died in North Carolina before reaching their first birthday. About 78% of infants were born to women that were receiving adequate prenatal care. That number could be higher. 1 in 8 women of childbearing age was considered uninsured. So that's what your transcript says. What are you going to do about it next semester? Next slide. Maternity care desert is a newer term. Many of y'all have probably heard of like food deserts, or I've heard of pharmacy deserts where there's not a pharmacy within a certain geographical location of a county. You see the definition of maternity care desert there. In North Carolina, it's 21% of counties. Okay, March of Dimes, and I encourage you can pull this up now or later, but they actually have the map color-coded to show which counties are designated as maternity care deserts, meaning if someone was to go into labor right then and there, how far would they have to go to give birth safely? Women travel 2.5 times further if they lived in a maternity care desert in North Carolina than those that are in a county with full access to maternity care. And time is precious, right? No amount of money can buy you a whole nother day or a few hours. That's precious time. So I encourage you guys to look at some of that. So when we think about, next slide please, when we think about when Hurricane Helene was coming, right, I found this, and this was from later in the year, that talked about Helene's impact only magnified existing challenges in maternal health. Because if it hit a maternal care desert, or a county that was designated as a maternal care desert, and you're pregnant, you're already stressed. Soon as you hear this storm is coming ashore, right? The stress amplifies, the cortisol amplifies, the aches amplify, right? Trying to figure out what in the world that you're going to do. And these are actual headlines from Georgia. I think this one may have been from North Carolina, the woman that was clinging to a mattress with her dog, okay? So again, like I said, I care about birth justice. This is my passion project. Y'all are here because you care about environmental justice. It's only exacerbating some of the issues in maternal and child health. Next slide. We advocate for a focus on pregnant women and children, as these groups are particularly susceptible to both immediate and long-term health effects of environmental disruptions, including increased risk of preterm birth, low birth weight, and mental health challenges. So like I said, if you're an environmental justice advocate and you hear this information, you're like, yeah, no. The two are hitting each other, and it's amplifying the issue. And this story really, really grieved me. These are the youngest Helene victims in Georgia. Newborn twins, they perished with their mother when a tree fell on their home, right? So sometimes we need imagery that's hard to shake to remind us of why we need to care. I'm not a mom. I don't want to have kids. It's not my community. My kid's grown up. I'm a grandparent now. I'm a student, and I'm cute. I don't have time for this. Yes, you do. Right? Next slide, please. In terms of disaster management, there are considered to be 4 cycles. I am going to zoom in on preparedness because we know that there are lots of infrastructure issues, and the reason I zoom in on preparedness because it's something that you can talk to somebody about and they can do something about it today. They can take inventory of how much food, how many batteries, like there are certain things they can start doing like now, right? So the CDC talks about several different types of public health emergencies. Natural disasters are only one. Outbreaks and chemical radiation emergencies are another type, right? But pregnant, postpartum families, and those with young children must be considered in all of these phases. So As the new year begins, you're having your city council, you're having your faith-based meetings. Please think about this. Next slide. Complicated graphic, would you agree? But it's to show you that there are people like Dr. Emily Harville, a colleague of mine at Tulane, that have already mapped out if a disaster is hitting, what are the short-term effects on a pregnant mom and their infant? What are the long-term effects, right? Relocation, family functioning. This is the 20th year anniversary of Katrina. We're not just celebrating Carnival and the Super Bowl coming right now. We're also thinking about what have we learned in the 20 years and how are we better or worse because of COVID now, right? So there's papers from Puerto Rico, there's papers from Louisiana that have been looking at the long-term effects, right? So think about that for your community because you've been most recently hit. But we can see what some of the outcomes are. Next slide. Shout out to me, tooting my own horn. It can be very hard to publish when you're teaching and you're doing all of the things, but a paper that we had published last year was called Evaluating Infant and Young Child Feeding During Emergencies, Support in the Low Breastfeeding Population. Louisiana, outside of our wonderful culture, music, and food, we're not always on the top of lists, right? And so in terms of our breastfeeding rate, we're at the bottom of the list. And you think about if people aren't breastfeeding as much, then they're formula feeding. Well, if a disaster hits and formula supplies are low, are you following the train of thought? Okay, so next slide. We, some local doulas, which are birth workers that help those that are expecting or have new babies, they launched a hotline where people could call in as different storms are approaching to say, like, what do you need help with? It was supposed to be more around like feeding the baby or like maternal health stuff, but we got a lot of interesting data from the call. So I shared the full paper with the team and they're going to distribute it to you all, but this is just one table that shows from Hurricane Laura, which happened the year the pandemic hit, which was a Category 4 that hit a different side of Louisiana, and Hurricane Ida that hit the southeast side almost a year to the date later. What were some of the supplies people were calling in needing? What were some of the referrals they were needing? For example, a good practical one is WIC. Y'all know what WIC is? Not with me? Okay, WIC. WIC has a process for if you evacuate out of state because of a disaster, there's a process, right? You don't have to reapply for WIC in that state. They should be able to help you transfer your benefits. That is actionable knowledge that expecting families, especially with low wealth, need to know, okay? Breastfeeding challenges, other interesting calls. Disabled mother, seeking a cane for an elder. We talked about intergenerational needs and intergenerational conversations. A lot of families live with their older generation. Great aunt, uncle, grandma's there, right? So that also complicates the stress in different things. Next slide. We also learned about the importance of partnering. When Hurricane Ida was hitting New Orleans, the New Orleans dudes, they couldn't work the hotline if they're trying to get to safety for themselves. So they partnered with an organization that could work remotely to man the hotline. So again, you're in North Carolina, I'm in Louisiana, right? Not geographically next door neighbors, but think about these things before the next thing happens, because unfortunately there will be a next thing. Next slide. What resources and support would be helpful for pregnant and parenting families during emergencies? You don't have to recreate the wheel. We have some findings to share with you. Of course, food, clean water, shelter, transportation, really thinking about those that may be undocumented, those that may have different language needs, those that may have physical challenges, those that don't have transportation to evacuate. Because a lot of the CDC guidance is evacuate. Well, shit, what if I don't have a car? Right? So now in New Orleans, there are these statutes where if a storm is coming, and there's mandatory evacuation, people can go stand next to those and people will help them evacuate. Next slide. A big tip, breastfeeding is food security, especially during disasters, because mom and baby, they can stay together and they can go, right? So I want you to think about that because we're so formula dependent. And during the pandemic, we also saw infant formula being recalled. So some of our next steps, we did a webinar series to kind of have these conversations. I have links to those recordings that I shared with the team. We're getting ready to do focus groups and surveys to kind of find out what else do we need to be looking at moving forward. We're working on training birth workers and doing collaborations. I'm really excited about our study tours to Puerto Rico and the Virgin Islands because they don't have political voice in terms of who gets elected or not. And they keep getting hit. And those are Black and brown communities that have to hold themselves down. And working with University of Puerto Rico right now on a grant. Next slide. So this is a quote based off of some work in the USVI. As the frequency of the most intense hurricanes is expected to increase, clinicians, governments, and health systems should work collaboratively to implement hurricane preparedness. For you, it's any type of preparedness. Scratch out hurricane. Any type of thing can hit, like, you're not coastal, but you saw it, right? And response plans that address pregnant women's unique needs and promote optimal maternal infant health. So next we're going to do a little bit of a poll before I take my seat. Next slide. So if your answer is yes, raise your hand loud and proud, okay? There are 8 questions on the next slide that are going to ask you how prepared you are. And you're going to participate because I'm looking around the room. All right, next slide. Number 1, I have an emergency meeting place for family members other than my home. Raise your hand high so the people next to you be like, I should have one. All right. 2, my family and I have practiced what to do in case of a disaster. Now, I could say tornado, but what about fire? What about flood? They left disaster open because we need to think about multiple types. Number 3, I have a plan for how my family and I would keep in touch if we were separated. The back is killing it, y'all. I see y'all. I see y'all in the back. I see y'all in the back. Number 4, I have an evacuation plan if I need to leave my home and community. Okay. 5, I have an evacuation plan for my child or children in case of disaster. Okay. And I know everybody's not a parent, so I have copies of important documents like birth certificates, passports, insurance policies in a safe place outside of my home. I have emergency supplies in my home for my family, such as enough water, food, and medicine to last for at least 3 days. Good job. So this is where most of the class is doing well, and I want to celebrate that. There's an asterisk because if you're in Hawaii, they changed the time frame to 7 days. So you got to think about if you're remote, if you're rural, you might need more supplies because it may take you longer to get resettled. Last but not least, I have emergency supplies that I keep in my car, work, home to take with me if I have to leave quickly. Okay, next slide is personal assessment and reflection. What is your score out of 8? You don't have to yell it out. You know what it is, though. Which areas are you most prepared versus least prepared? Food for thought, Dr. Gross, because I didn't know I was going to have to take a test today. But professionally, how would your community and the families you serve answer? Which areas are they most prepared versus least prepared? Next slide. In terms of reports from Tennessee and Hawaii who have used these questions with new mothers reported being most prepared with supplies for several days, least prepared with copies of important documents. So, again, a tangible place to start. Birth certificate, passport, driver's license, all of these different things. Families need support in preparing for and practicing what to do in case of disasters, because there's different types. So let's simplify it, because the 8 questions, research found that they can boil down to really 3 areas. Do you have plans? Do you have copies? Do you have supplies? Help people prepare in pieces, okay? Get a game plan.org. Oh, I'm sorry, next slide. Prepare in pieces, plans, copies, supplies. GetagamePlan.org, ready.gov. National Preparedness Month is in September. Next slide as I close. This can be a lot to take in, not because I can be a bit animated and much, but perhaps you haven't been thinking about environmental justice or disaster preparedness in this way. But that was the point, okay? So let's end empowered and hopeful. Next slide. Exposure to heat, wildfire smoke, and we send prayers for California. Flooding, hurricanes, it's all associated with negative maternal health and birth outcomes. And that generation has that and can pass that trauma on through epigenetics to the next one. But if they're prepared, we can buffer some of the effects, right? As we're working on our big systems level change. Birth workers and grassroots organizations are filling a gap that unfortunately the government is not. Next slide. Pointing at you again. Because again, we need to collaborate and advocate and understand maternal and child health needs, how to integrate maternal and child health services with what's already going on to make it an easier lift for families, foster community-based solutions. The community expertise already exists. It doesn't have to be top down, and we work together because collaboration is key. Next slide. We want to be hopeful, right? Every time I see this thing about Tupac or Rose that grew from concrete, but anyway, because if we're not hopeful, right, then what are we doing? If we don't realize things can be better, then what are we doing and why are we doing it? Next slide. These are some of my friends in this work. So if you wanted to follow any of what they're doing, Dr. Emily Little just had her first baby last year, and she's in Oregon, has done some stuff on wounds and wildfires. And I'm just like, wow, how much does California need her expertise right now? You can see some of the others there. So thank you for your time. My closing slide. Just want to encourage you to answer the call. Maternal and child health may not be your front and center passion project, but if environmental justice is that thing, this aligns with that perfectly. And so in the days ahead and the roads ahead, we definitely need to work together. Thank you so much, North Carolina, for your time.